aortic valve is the valve that separates the left ventricle, which is the main pumping chamber of the heart, from the aorta, which is the main blood vessel in the body. Each time the heart squeezes, that valve opens up, allows blood to flow out to the body, and then between beats, it closes back down again to prevent blood from coming back down into the ventricle and basically keep blood from going the wrong direction. There's two ways general ways that valve can be diseased. One is becoming stiff. The medical term for that is aortic stenosis. With each beat, the valve leaflets normally open and then close again. But with aortic stenosis, the stiff valve, that valve is just not opening completely. That creates significant obstruction to blood flow, puts a big strain on the heart muscle to overcome that stiff valve. The other abnormality with the aortic valve that we want to talk about is something called aortic insufficiency or aortic regurgitation. And that's where the valve doesn't close properly and blood leaks back into the ventricles. Aortic stenosis is present in about 12 to 12.5% of the patients over the age of 75. What's most common is what we call senile aortic stenosis, meaning over the years, the valve gets damaged and, for lack of a better term, worn out, so it becomes stiff. Now, that doesn't mean that when you develop aortic stenosis that something has to be done about it right away. Just like anything else, there's mild, moderate, or severe, or critical aortic stenosis. We first start with medical management for milder forms of the disease, and then think about valve replacement or valve repair once the disease progresses past a certain point where it becomes critical that you do something to keep the heart from developing significant dysfunction.